The alarm bells were initially raised by a spike in COVID-19 related hospitalizations in São Paulo's top private institutions, like the Albert Einstein Hospital, which warned on November 13 of a surge in patients being admitted with the coronavirus, and stating that the figures were evidence of the need to keep preventive measures in place.
Doctors and health authorities say the spike in infections has to do particularly with the growth and the number of cases among the youth, who after months of confinement are again hitting the streets to try and have some fun.
We probably are dealing with the beginning of a second wave of COVID-19 infections. It started last week. It's happening in the great Brazilian cities, especially with São Paulo and Rio de Janeiro.
Groups gathered on the streets of big cities like São Paulo, often with no distancing or masks, have become a common sight in popular nightlife districts.
For me, this is like an escape valve, something to distract me a little from the problems I'm going through and of everything I am feeling.
Days after the initial warning, São Paulo's state government acknowledged a one-week growth of 18% in hospitalizations, took measures to increase the availability of beds, and postponed any further reopening of activities.
Com o tempo e com esses números de pessoas jovens portadoras do vírus,
over time, and with all these young people catching the virus, we began to see them passing on infections, hitting also those in the risk groups like the elderly and those with other associated diseases.
Não façam aglomerações.
Do not participate in gatherings. Do not get in close contact with people in bars, restaurants, parties, the streets, the beaches or the parks.
Meanwhile, Brazil is putting high hopes in the development of COVID-19 vaccines. The first imported batch of 120,000 doses of the CoronaVac candidate, developed by Chinese biotech firm Sinovac, recently arrived from China and awaits the conclusion of trials and Brazilian regulatory approval. With more than 6 million total infections since the start of the pandemic, the arrival of safe and effective vaccines can't come soon enough. Paulo Cabral, CGTN, São Paulo.